If you are afraid of going to the dentist, I need to tell you something. Many traumatic experiences in dental offices could be avoided if patients knew a few simple things before their appointment. The problem is that almost no one talks about this. Today I'm going to explain what you need to know before you sit in the dentist's chair in order to avoid unnecessary pain, unpleasant surprises, and even health complications. But first, let me introduce myself. My name is Dr. Nara Abdalla. I have been a dentist for more than 30 years and I specialize in dental implants and bone graft procedures. Throughout my career, I have treated thousands of patients, and one thing I notice all the time is that many people arrive at the dental office without knowing very important information that could completely change their treatment experience. That's exactly what I want to talk to you about today. You know that moment when you schedule an appointment, arrive at the clinic, sit in the waiting room, and suddenly your heart starts beating faster? Your mind begins to think about 1,000 different things. Did I brush my teeth properly? Is it going to hurt? Will the dentist have to remove my tooth? Will the anesthesia actually work? If you've ever felt this way, let me tell you something. You are not alone. Millions of people feel anxiety before going to the dentist. But there is a much bigger problem that most people don't realize. There are important pieces of information that many patients fail to share, and that can turn a simple procedure into a very difficult experience. That's why today I want to show you what you need to know before visiting the dentist. Because the truth is this, your appointment does not begin when you open your mouth. It actually begins much earlier. Now imagine the following situation. You are sitting in the dentist's chair. The anesthesia has been applied. A few minutes pass, the dentist starts the procedure, and suddenly you feel pain. You realize the anesthesia didn't work. This happens more often than you might think, and there is a scientific reason for it. When a tooth is very inflamed or infected, the environment around it becomes more acidic. This acidic environment reduces the effect of the anesthetic. In other words, it's not in your head. It's not because you have a low tolerance for pain. Your body is reacting to the infection. That's why when a dentist says something like, "First we need to control the infection with antibiotics and then perform the procedure," they are not delaying your treatment. They are protecting you. Trying to extract a severely infected tooth can cause more pain, more inflammation, and even serious complications. For that reason, one very important thing you must tell your dentist is how long the tooth has been hurting. Is it throbbing? Is it swollen? Is there pus? Have you had a fever? These details help the dentist choose the best treatment and the right moment to perform it. Now let's talk about something even more important, something many people hide. Medical conditions such as high blood pressure, diabetes, and high cholesterol. If you have any of these conditions and you don't tell your dentist, you may be putting your own safety at risk. When you sit in the dentist's chair, your body is already in a state of alert. Your heart rate increases. Adrenaline rises. Your muscles become tense. Now imagine all of that happening in someone whose blood pressure is already uncontrolled. During a dental procedure, that pressure can rise even more. That is why it is essential for your dentist to know your overall health condition. In the case of diabetes, the situation also requires special attention. Diabetic patients may experience slower healing. That means a simple procedure might require additional care. Often dentists prefer to schedule these appointments in the morning when blood sugar levels tend to be more stable. Another common mistake many patients make is thinking, "I'm going to the dentist today, so I shouldn't take my medication." That is a mistake. Never stop your medical treatment without proper guidance. Another extremely important point is the medications you take. Antidepressants, anti-anxiety medications, antipsychotics, mood stabilizers, and medications for seizures can interact with anesthetics. This interaction may reduce the effectiveness of anesthesia or even cause unwanted reactions. So when your dentist asks, "Are you taking any medications?" they are not being curious. They are protecting your safety. Now let's talk about another point many people forget, allergies to medications. Are you allergic to any medicine? Pain relievers? Anti-inflammatory drugs? Antibiotics? This information must always be shared because allergic reactions can begin with something simple like itching or redness, but in severe cases they can become a medical emergency. That is why you should always tell your dentist about every allergy you know. There is another factor that very few people talk about: fear of the dentist. Between 15 and 20% of people experience dental anxiety, and many arrive at the clinic trying to hide it. But there is absolutely no shame in talking about it. A good professional understands this. They can explain each step, agree on signals to pause the procedure, give you breaks during treatment, show the instruments before using them, and talk with you to reduce anxiety. When communication exists, everything becomes easier. Finally, let's talk about the first appointment. Many people schedule a dental visit thinking everything will be solved on the same day. But most of the time that's not how it works. The first appointment is usually an evaluation. During this visit the dentist will examine your entire mouth, check your teeth and gums, request x-rays, and carefully analyze the situation. Only after that can the best treatment be determined. So if the dentist says, "Let's schedule the procedure for another day," it doesn't mean they are delaying things. It means they are following the correct professional protocol.